What is happening when you have inflammation? So when you traumatize tissue, this all makes sense critically. If we critically think this through, it makes perfect sense. You hurt yourself, immediately the blood supply to that area increases to take things like platelets, which will help clot and repair damaged blood vessels, red blood cells to deliver nutrients and oxygen to help repair and deliver the increased energy needed, white blood cells to fight off any foreign invaders. We increase the blood flow to the area. Blood is warm. What happens to the area? It gets hot. Blood has volume. I've now increased it. What happens to the area? It swells. My brain is saying we need to repair this area. I don't want you to use it for a while. What do I get? Hurt, pain. Pain is your body saying we've got to repair some damage. Don't use this for a while. And so once all of the repair is done, my body has had its crew come out, the handyman has come out, done the repair. Now I need something to undo all of the stuff we did to make the repair. And we've got this stuff called histamines and heparin. And what histamine and heparin does is basically just calls off the construction crew. They say, okay, boys, this is all done. Great job, great work. They take down any scaffolding, clots. They take down and any other repair equipment they might have needed. And so the cleanup crew is histamine and heparin. So that's what's happening when you have something that is inflamed. And this is true no matter what. You try and pop a giant pimple that is one of those super, super deep ones. I don't have one. I'm just pointing to my forehead. Quit. You're all looking at me like, no, does she really have one? No. But you know the super deep ones, and you try, and then you end up with this ginormous boil-looking second head on your face. Inflammation. You stub your toe. Inflammation. Every process is exactly the same regardless of why. The inflammatory process remains the same. I find that fascinating.
Well, what if I'm having like infections, where it just keeps like on growing?
So sometimes, so you get an infection, bam, inflammation. Inflammation is your initial step to literally everything. But there are some infections that will overwhelm your immune system. This is super tragic. So I'm just going to do a random scenario. You step on a piece of garbage, you cut the bottom of your foot. You have now got bacteria that has infiltrated into the tissue. Into the what? The tissue. You get the inflammatory response, the heat, the swelling. White blood cells are now having to fight off this foreign invader. Think of like the first 5 minutes of Saving Private Ryan. But those are your white blood cells, because these foreign invaders, this particular one that got in you, super aggressive, super mean, and a super good fighter. And he's killing off all of your white blood cells, which are falling dead to the floor. You now have white blood cells having to crawl over dead bodies to get to the foreign invader. And they're just retreating deeper and deeper and deeper into you. Bam, abscess. So now you have this giant pocket. We usually will say a giant pocket of infection. No, those are dead cell bodies. Those are the dead bodies. Have you seen Saving Private Ryan? So you know the scene I'm talking about, where literally the entire beach, people were crawling over 3 and 4 deep dead bodies. That's what's just happened in your foot. I mean, it's so dramatic. This incredible battle has taken place. Now when you're got this massive boil-looking thing and the doctor goes and cuts it open and all the pus leaks out, all pus is liquefied dead cell bodies. That's it. And then we have to give your immune system a little bit of
So
assistance.
pus is just like dead white cell, dead blood cells, like the white
Yeah,
blood cells.
pus is dead white blood cells that have sacrificed themselves in the battle, and dead foreign invaders that were sacrificed in the battle. And then my body was unable to get rid of the infection by itself, so what do I give you? I give you just a prescription for some antibiotics. And that just helps to call in the cavalry and have some backup for immune system. So that's what happens when your body cannot fight off the infection for itself. It'll sure give it the good college try though, holy smokes. And that's one of the big issues. I'm going to bring it back just for a second to something we've all been dealing with, hence this, the COVID. What is happening and why it is so detrimental is it's not just a respiratory. You get the COVID, it's not the COVID that'll kill you. It's your body's response to the COVID. So now your body has gone, oh my God, stranger danger. Send everyone. Suddenly you have increased blood flow to your lungs. Well, the blood vessels and the alveoli in your lungs that is dependent on gas exchange. What happens if I try and fill up something with a fireman's hose? If I have a small bucket and I try and fill it up with a fireman's hose, that's exactly what happens in your lungs. The pressure of the blood trying to get all of the cells, all of your military at once, bursts out all of those very delicate vessels, allowing fluid to leak into the lungs. Plus you have massive mucus being produced to try and crowd surf. So now you have fluid leaking from ruptured blood vessels, and you have fluid accumulating because of the increased mucus production. You are literally drowning in your own body fluid because of your immune system, your response.
I've got a question.
Sure.
So, like the pus, we knows the white blood cells and the foreign invaders. Is that also like the lysosomes are going to be in there too? The ones that actually kill stranger danger?
Yeah, so the lysosomes we have as an organelle in some of our white blood cells that help to break down anything that our phagocytes have engulfed. Because that's how they're getting rid of the foreign invader. Some of our white blood cells form a wall and a blockade. Some of our white blood cells go into the thick of the battle and they engulf the foreign invader. And then the lysosome will either kill the foreign invader or the cell will sacrifice itself and die, also killing the foreign invader. And so that's how your white blood cells work to protect you from stranger danger. They all have their own little job.
And is it a certain part in the body where the white blood cells do perform a barrier or actually attack? Is it like
just literally anywhere you have a foreign invader coming into you? They are there to protect you and prevent it. The first thing that will happen is they'll try and form a barrier to prevent them from getting deep within you. And then the second thing they'll do is call in the phagocytes that will engulf and kill anyone that gets in. So the whole idea is to keep it from getting deep within your body, because the deeper something gets within your body, the more difficult it is to get rid of. And so that's why we first form a barricade, and then we send in the troops to actively go in and kill anything that is still remaining. The healing process is amazing. So as we are healing and we're battling the foreign invader, the other thing we've got to do is repair the damaged tissue. So everybody in here, if you've lived, you have a scar. Every single person in here has a scar, whether it's a tiny chickenpox scar or a big, I fractured my skull scar. Everyone has one. But why does that scar tissue look different than the tissue around it? granulation tissue. So what ends up happening, you already went over the layers. Remember there was a layer called the stratum granulosum? Well, what ends up happening is as your epithelials are repairing, because remember they come from the basement membrane and they repair up, what we're going to end up doing is have more of those granular cells because they tend to be a little bit stronger. And what's happening is because I have, here's the V of the cut, I have these two edges, I'm going to fill it in with this granular tissue because during the healing process, I don't want it to open and I don't want it to be flexible. But the process, through this process, if you have enough granulocytes, if you have enough of this stratum granulosum, suddenly now the finished product does not look like the original. I'm pointing here because I do have a pretty nasty scar on my arm. It doesn't look the same and it doesn't have the same elasticity. It's not meant to because it's meant to prevent flexibility. Now, over time, the tissue will start to blend in. But I know you're looking at it like, I don't see anything on your arm, Miss Huff. But if I do this, you can now see that that scar tissue is way less elastic than the tissue around it. Is it doing it? Can you see it? Okay. I can't see it. So I'm like, you guys are looking at me. I don't have my glasses on. So I'm like, am I doing it? Or are they just looking at me weird? Way less elastic because that was the whole point. So that's this granulation tissue. Now, some wounds we just let granulate in. Like if you get a paper cut, are you rushing to the ER to get sutures? Of course not. If you oh my God, Douglas, no, scrape. Oh my God, I might be having a stroke. I might be having a stroke right now. No, I'm okay. It's fine. I couldn't think of the word scrape. You scrape your knee, we're going immediately into traction. Of course not. You just let it scab. And then usually you pick the scab off. It bleeds, re-scabs, you pick it off again. Yeah, I'm looking at some of you who are like trying not to. No, I don't do that at all, Ms. Huff. Everybody's a picker. You pick the scab, it bleeds. Pick it again, it bleeds. What happens if you consistently pick and pick and pick the scab off and off and off and off? Do what? Yeah, because mentally, this is really funny. So you cut yourself. So you visual guys see the cartoon. You cut, your platelets go, oh my God, something's happening. And they go running to the cut and they pew, 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 pew. And they're like Spider-Man in that movie with the boat. They're pulling the edges together. And meanwhile, other platelets are forming this giant web because we want to stop the blood from leaving. Blood on the floor does you no good. But the other problem is we got foreign invaders trying to get in. Oh my goodness gracious, and the white blood cells, they're whoa, and they're now hanging on to this web and they're whacking, killing, battling, crazy. And I know, you're gonna think about this the next time you cut yourself. And then what happens? We kill off the foreign invaders, we prevent them from entering the body. The platelets continue to lay down layer after layer after layer after layer. The fibers dry. The blood cells that were incorporated and hanging on to this web, this net, are kind of fused and their bodies actually strengthen it. What have we just formed? A scab. And so now under that scab, we are now protected from anyone else trying to enter in. Now the workers, the reconstruction crew can come in and they start laying down the foundation. They start slowly removing the web. replacing it with granulation tissue, removing the web, and they're working from the inside out. And so what do? Pick, pick, pick. And everybody goes, come on! Come on! We just fixed that. And then the platelets have to go and pew, 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 and battle, battle, battle. Build, build, build. And then you pick it. And what do they say? Come on! Until eventually you picked it so much that now the construction workers are like, you know what? They're swearing under their little cell breath. And they're like, hey, Frank, yeah, go get that industrial strength stuff that we never, ever, ever use. Yeah, go grab that. We're going to teach her a lesson. And they start laying down like this super, super massive concrete worth of tissue, which is now you've got this terrible scar where if you just left it alone, it would have healed and nothing would have even shown. Are you okay?
I'm real tired, so this is extra funny.
The next time you cut yourself or the next time you go to pick off a scab, I'm going to be living rent-free right there.
Make us feel bad.
I know, you're going to be like, I'm undoing all the work that you just did, little buddy.
The thing is I have a kid and she like scratches and picks off her scabs. I know every time she comes to you, Mom, I'm bleeding.
You're going to see all of the cells going just like, come on!
So do they use that like on your fingers and stuff? So it's like I have scars on my fingers from wrenches and stuff. I don't pick those scabs on those. They're still scars. Like
so
it's a different.
You've just made an absolutely fabulous point. It also depends on where the cut is. I cut myself on my knuckle. What happens every time I bend my knuckle?
It's smooth. Okay.
It opens up even a little bit, even if the scab doesn't come completely off. Every time it goes. So you do have areas on your body that are much more prone to this thicker granulation, and it's really crazy because your body is highly intelligent, and it just knows if I have a cut somewhere that is bendy, go ahead and lay down that extra super industrial strength stuff to begin with. And that's why you may cut yourself on a knuckle or on your knee, on your elbow, anywhere that's bendy. And you'll, even if you've never picked the scab, end up with a pretty nasty scar. This scar I had here, I've had this now like longer than most of you have been alive. But it is, in fact, about this wide. About this long.
Miss Huff,
Yes.
2 questions. The first one is on chat. When we do hydrotherapy on an animal, how does that help the healing process? They do a lot at their clinic with lesions and large open wounds, but doesn't understand how hydrotherapy helps.
So that is, hydrotherapy helps in a couple of different ways. The first way is the flushing effect to get out any additional foreign invaders or debris that may retard the growth. The second way that hydrotherapy works is, and we only ever use hydrotherapy on very, very significant wounds. Think of the degloving wound. So what can sometimes happen, and we did have the drain tubes. What can sometimes happen is, so we have the skin and the underlying tissue, and we now have a space in between them. It's not adhered anymore, right? We've got a space. And what can sometimes happen is that this will heal and this will heal, but not together. And so what hydrotherapy does is kind of in a very, very gentle way, On the inside, pick the scab, pick the scab, pick the scab, because I don't want these two to heal separately. Because then this is gonna fall, the skin is gonna fall off because we've got no blood supply. We've healed away from all the blood supply. And so we're gonna end up with this big, huge swath of dead tissue. So what the hydrotherapy does is, in a very gentle way, scratch the scab, prevent it from healing so that we can get it to come back together and heal as a single, get the skin to the underlying tissue. So that's what hydrotherapy is doing. We also use some natural cures. The most common, believe it or not, is honey. Now, I'm not talking about the crap in the grocery that you get in the bear. That's not honey. I'm talking about going to a beekeeper, getting true, pure honey straight out of the hive. It never expires. It has natural antibiotic properties. It helps to promote tissue healing. It helps to reduce inflammation. Honey is the natural catch-all medical cure. So, what was your second question, Charles?
My other question was, okay, so the new tissue is the granulation tissue. Is that why you people have psoriasis, because it's overactive, constantly repairing even when there's no damage?
Yeah, so you do have some autoimmune disorders like psoriasis, like eczema, which is where your body is viewing a threat where there is none. So yeah, similar idea. Although animals don't really get psoriasis or emphysema or eczema.
So if there's like if you get like a hypertrophic scar, what kind of tissue is that? Is that
Granulation.
Okay, so that's the rubbery stuff.
No,
Does it still shed? Like, because it's a rubbery and it's not like this. So I was wondering, is that like still shed, or is it like
I'm not really sure what you mean by a rubbery scar.
dead cells, like hypertrophic scars?
Are you talking about like proud flesh?
I don't know.
I don't understand what you mean by hypertrophic scar.
Like keloid hypertrophic.
A keloid is different than a scar. Keloid is having specifically to do, it is still with an immune response secondary to trauma, but the formation of a keloid is different than the formation of a scar.
So is it still
So my answer would be, apparently my knowledge of veterinary medicine is not going to translate to this question. I don't have it. I don't really understand. Why don't you see me after, Ace, and we'll see if we can't figure out what you're trying to say.
all right.
Yes.
Are keloids calcified?
No, they are not. They are not. Now, I'm going to get off keloids right now because it's not veterinary medicine and it has nothing to do with the healing process that we're talking about right now.
What causes the scars to raise? Because sometimes there will be scars that, like, instead of like healing flat on the body, it'll
The
raise.
exact thing that I was just saying.
Okay, so it's the same thing.
If you have it constantly being worried and you're now filling it in, and they're going to overfill it
Okay,
just to give it that little extra oomph.
Yeah, that's
When I first got this scar, it was completely raised. It looked like I had a big pink worm on my arm. So here we have a pretty nasty wound. Not quite a D glove, but pretty close. Does anyone want to guess, is this a front leg or a back leg? This is, in fact, a back leg. And how I can tell is that is the tarsus. That is the equivalent of your ankle. And technically, this is the ankle. It's the equivalent of your heel. And we've got a pretty nasty wound right here. And we can already start to see. Now, obviously, were my platelets able to get the edges together? Of course not. So normally, if I have just a thin laceration, they're going to pull the edges together. In this case, we didn't have that option. What we do have is it's healing. You can see this white line. That is where we're slowly healing the tissue from the outside in, and then it will meet in the middle and form a ginormous scar. What I don't want to have happen is, number one, look at this big pocket of dead tissue right here. Do I really want that healing permanently into the body? Of course not. I've also got what looks to be some debris. And when this scar tissue forms, is it as elastic as the tissue around it? Is this not on a major joint? Is this going to impede the animal's ability to move? So what I need to do is go in and do some intervention. I'm going to cut out some of this new granulation tissue. I'm going to irrigate. That's where our hydrotherapy is going to come in. I'm going to go in and repair this tissue here with sutures. And then I'm going to use honey and hydrotherapy to help make sure that even though we're filling it in with scar tissue, that it is supple enough to be able to bend and be flexible. Now, here's what I just mentioned.
I've got another question. So would you do stitches for that or like a skin graft? Because that's pretty big.
We don't normally do skin grafts in animals. We allow it to fill in. I honestly, being in general practice, I've never even heard of doing a skin graft. Could you? Theoretically, yes. I've never heard of it being done before. Here we have in horses, we have here an injury where we've allowed it to fill in, but similar is to what you were just saying. So the body fills it in, fills it in, fills it in, and then never stops filling it in. And you end up with these ginormous like scars pouring literally out of the body. And we call that in the equine, some of you equine people would know, it's called proud flesh. And what you end up having to do, because it is so thick and it's over a joint, you have to go in and cut it out. So we have three different...
Wouldn't that just create more scar tissue and make it bounce up even more, cutting it off over and over again?
So we're not cutting it off over and over. What we would be doing, so when you get the proud flesh, what's usually happened in the equine world, we don't typically see the same overgranulation in small animals. I mean, you can. But in the equine world, what happens is it is so... Do I have any horse people here? I didn't think so. Think about, okay, so if Poppy or Maisie cuts themselves, I load them in my car. I run them up to the vet real quick. So if my 1,500-pound horse badly cuts its leg, can I just throw him in the car and take him to the vet? No. It is $1,000 to get the vet to walk on your property. Not kidding. $1,000 because they have to come to you. It is $1,000 to get them to walk onto the property, and then you start incurring. So guess what horse owners do? They try and doctor it themselves. And a lot of them have are very skilled, but this would be a wound that was left to heal on its own and now needs surgical intervention. And this is where we would begin with the honey and the hydrotherapy and the medical intervention, rather than just allowing it to heal on its own. So we have 3 different classifications of how wounds heal. We've literally just spent the whole class talking about this. Now we're just giving some definitions to it. The definition of first intention healing is where I have some sort of outside medical intervention holding the edges together. You cut yourself, you go and get stitches. You have something holding the edges together. You cut yourself, you get staples. Even you cut yourself, you get, those one of the little butterfly that act like stitches but aren't stitches. That would all be first intention healing. Something is holding it together. Second intention healing is when we let it heal on its own. The paper cut is second intention. I got a little, I don't even know what I did here. I got a little, okay, I won't pick it off because I just heard my body scream, come on! I don't even know. But I'm not going, there's nothing holding it together. So any wound that is just left to granulate in on its own is said to have healed by second intention healing. Third intention is a combination of the two. Third intention would be where I leave it to granulate in for a small, short amount of time. Perhaps I am worried about contaminants. And then once I am convinced that it is safe, I go back and close it with some sort of outside closure. So first intention, the edges are being held closed. Second intention, we just allow it to heal by itself via granulation tissue. Third intention, also known as delayed closure, is where I leave it open for a while to flush out all of the pathogens and then close it afterwards. So everything we've just had this amazing discussion over, now we've just given some terms to it. What questions could I answer for you about that?
When would you use stitches versus staples?
Oh, that's personal preference.
Do they also use like the glue as well?
Yeah, we also use the tissue glue depending on the level of the injury. So yeah, the primary closure is going to be personal preference. And it's also going to be dependent on where is the injury. A lot of times we use staples instead of sutures to get it done far quicker. It does not end up with as pretty a closure. So typically we would use staples on a routine surgery that we're trying to get off the table. So we can clip, 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 clip. It's in a midline incision, so it's really not going to show. Doesn't matter if it's super pretty. Get the animal up and off the table. For anything else, to make a more kind of streamlined healing, we would use sutures. And then there's several different suture patterns that we're going to teach you. And depending on where it is, what kind of tension do I have? Do I have force constantly trying to pull the edges apart? Or is it super loose tissue and it really doesn't matter? That will determine what kind of suture you put in. So.
There's a question in chat. So for wounds with pus, would you use the first intention with the drain tube and then later close it with like
Okay, so you're asking me about specific wounds, and my answer is going to be to every single one of these. It depends. It depends on what caused the wound. It depends on what kind of contamination we have. It depends on the temperament of the animal. If I have a feral cat, do I really want to try and do hydrotherapy 3 times a day? I can't. There's no way. So all of those things will go into consideration as far as how to treat the animal. These 3 terms are simply denoting what did we do? Did we do the stitches? Did we leave it to heal? Did we leave it to heal and then put in the stitches?
Can the Band-Aid be first intention or third intention?
Depends on the Band-Aid.
And if you do third intention, wouldn't it cause like more dirt to come in, like more pathogens?
Well, no, because I'm not leaving it open and sending you home. I'm leaving it open and providing medical. So then I'm going to be doing the flush it, rinse it with antibacterial solution, putting on the honey. I'm doing that in a controlled environment at the hospital.
Because I heard if you do that for like more than 24 hours, you can't get sutures.
Okay, again, you're talking human. We're talking animals and the intervention that we provide the animals. Now, are we going to leave it open for a week? No, of course not. 24 to 36 hours is usually about the limit to where we're then going to put in the sutures. We just need to make sure that all contaminants have been removed. So here's a couple of human pictures for you. So on this one, if I were to just leave this open and let it heal, what intention healing have I used? I just leave it open. Second intention. Now, see, you thought I was going to say the first intention first, and I tripped you up. Now I'm going to go ahead and put sutures in it immediately after it happens. That would be immediately after it happens, I put sutures in. First. Now I leave it open so that I can flush it and put in my sutures afterwards. Okay, do y'all see the difference between the three? Excellent. And that is the tissues. So, what I'm going to do now, I've got a few minutes left. Don't forget the tissues test will open today at 3. It will close tomorrow at 7. I know I don't have the test yourself questions open yet. It's been a heck of a week. It's been a heck of a week. So what I want to do now is just kind of gauge where are we as far as the skeletal system, which is what we'll be starting tomorrow. Do what? It closes at 7, just like all my other tests. It'll open at 3 this afternoon. It will close at 7. And then your test yourself questions will be due anytime before 7. All right, so here's where we are as far as skeletal system. Let's just see where we are. What are the ends of the long bones called? The epiphysis. That's where our growth plates are. Did you all talk about the different ways that bones grow? Did you talk about the intramembranous bone formation versus cartilaginous? Okay, we'll talk about it. Don't let it confuse you. The shaft of the bone, the diaphysis. I'm going to point to one of my bones, and you're going to tell me what bone I am pointing to. Before I do that, are you all okay with the words proximal and distal? If you're not, you need to contact me and we need to review it. Because when I test you over the skeletal system, that's how I'm going to identify what bone or joint I'm referring to. I would say this bone is distal to this structure. All right, I'm going to point to a bone. That is the humerus. Radius and ulna. Now, which one, radius or ulna, makes up your elbow? The ulna. Does anyone know, did you go over what is the part of the ulna that makes up your elbow?
Olecranon.
Nice. The olecranon is what makes up the point of your elbow. What joint is this? This is the carpus. Metacarpus. Phalanges or digits. How do I number them? Medial, lateral. So basically what you're going to do, because you're like, okay, medial, 1, 2, 3, 4, 5. No, give air high 5. Always give air high 5, 1, 2, 3, 4, 5. If my dew claw is missing, that changes this number to what? I'm a cheeky monkey and I tricked you. It doesn't. The numbers don't change. This one's number 2 no matter what. If number 1 is missing, this stays number 2. If this one, both are missing, this stays number 3. Does anyone know what digit the horses walk on? Yes, we point it down. We point it down. Because otherwise I have 100 people going, Mr. Hamilton, let's not flip this off in class today. You point it down. It's the 3rd digit that they walk on. All right, so parts of the skull. Parietal. temporal, frontal, facial, occipital, the movable part of your jaw, the upper non-movable part of your jaw. Nice. All right. Your first cervical vertebra, also known as the second, the third. It's just it's just the third. See, I'm being a I caught your shenanigans today. I'm being a cheeky monkey. After the axis, it's just C3, C4, C5 until how many cervical vertebrae in our dogs and cats? 7. And then the cervical vertebra transitions into what vertebra? How many? 13. How many pairs of ribs do I have? 13. 13 pairs, 26 total, because every thoracic has a corresponding rib. What is the rib connection here in the sternum? My thoracic vertebra transitions to lumbar. How many? 7. Transitions before the coccyx. The sacral, which is where your vertebra articulates with your pelvis. And then you have the coccyx. How many bones make up your sacral vertebra? 3. Oh, creepy rule of 3. Creepy rule of 3. All right, how about right here? Femur. Oh, tell me the 3 parts to the pelvis. Very nice. You have your ilium, which I call your sassy bone. So when you're getting all sassy and you're like, you put your hands on your ilium. Your ischium is the part you're sitting on right now. If you bring your feet up and give a little wiggle, the butt bone is the ischium, and then the pubis. The 3 parts of the pelvis, you'll never forget that. Does anyone know what the cup is called that the head of the femur fits into? It does start with an A. The acetabulum, and the head of the femur fits in there. What kind of joint is this? Holy smokes, you guys, this chapter is going to be, do you see how easy this chapter is going to be? Big, round, irregular bone right here. The patella. 2 bones in my lower leg. Tibia, fibula. One of them is much more slender, much more delicate. It is, in fact, the fibula. Here's how I remember. When I'm looking at those 2 bones, and I'm looking to try and figure out which one is the littler of the 2, meaning thinner, I tell a little fib. To who? To you. Fibula is the more slender, smaller of the 2. Fibula. Tibia. Fibula. Tell a little fib to who? To you. This joint, tarsus, metatarsus, phalanges, and numbered how? Same way. You guys, holy smokes, you guys. So the only stuff we're going to go over that is really new information is how do bones grow, the long bones versus our flat bones. We're going to talk about some of the additional holes in the bones, but from what I understand, you already went over things like condyle, fovea, foramen, crest. We got this. All right, so I will see you guys. Oh, I did forget the scapula. Your